started to understand and to explore the impact and the possible impact of ICG, fluorescent dye, in cervical cancer for sentinel lymph node mapping in early stage cervical cancer. And this was a retrospective experience, a multi-center European experience that involved 5 centers in Europe, 3 in Italy, and 1 in Switzerland, and 1 in Spain, from Madrid and also from Berna. In Italy, there were 3 centers, Monza, Varese, and Rome. And overall, we are retrospective review 144 cases, women that had cervical cancer 1A2 to 1B1, and the results were good because the comparison between ICG and the standard method, including the radiocolloid and the blue dye injection into the cervix, demonstrated very well outcomes in terms of statistical result, a very low false negative rate and good positive and negative predictive value of both the procedure. But what we find was that ICG had a better overall detection rate of sentinel node with a nice statistically significant result in terms of bilateral detection that was close to 100% compared to the standard methods with radiocolloid and blue dye. And so this is very important, the result of our study, because the bilateral detection in the future and prospectively can avoid to perform a bilateral lymphadenectomy in that cases, particularly in low-risk cases with a tumor amount and diameter less than 2 centimeters. And also one important thing is that ICG is very manageable and easy to fit for the program of the surgery of those patients. And most important, I believe that this is an ideal tracer for the future of these cases, and because the patient doesn't have to go to the medical nuclear medicine department, and so it's easier, and also the quality of life can improve. Finally, I just want to discuss about the future of these techniques. Sentinel node probably will be the common ground between non-performing lymphadenectomy and bilateral lymphadenectomy in cervical cancer, and by applying a well-defined algorithm, probably we can have a false negative rate close to 0% in all these cases, particularly in a patient with a very, very low risk tumor.